I can't get into specific details about what individual companies have asked for or not asked for, and what's the details of the individual conversations. I mean, what I can tell you generally on the liability question is, of course, we're leaving no stone unturned to support the production of a safe and effective vaccine for all. Our intense negotiations are carried out with and on behalf of the member states. They're progressing well, as evidenced by this signature today. We're in the middle of an ongoing pandemic. These are extraordinary circumstances, and we need to act as quickly as possible to put an end to this unprecedented health crisis and to protect citizens. This does not mean that we will compromise on the safety of a future vaccine. Let me make that very clear. We will not be changing existing rules on liability. Any vaccine which is put on the market will have to meet the necessary safety requirements, which includes approval by the Commission following a recommendation for the European Medicines Agency as part of the market authorization procedure. Citizens' rights will remain fully protected. A separate question, the one that you raise, is whether authorities might indemnify the manufacturer if there is eventually found to be any liability for damages. Of course, in the race against time, vaccine manufacturers have to produce a vaccine a lot quicker than they would do under normal circumstances. It could be 12, 18 months compared to a decade or more in normal circumstances. So in order to compensate for such risks, the advance purchase agreements do provide for member states to indemnify the manufacturer for certain liabilities incurred. So as I said, it means that the EU and the member states are taking all the necessary measures to protect our citizens. A stricter safety assessment is carried out before any vaccine is approved. Citizens' rights continue to be as strong as today, but member states are ready to financially cover certain of the company's risks to ensure that these vaccines can be available for EU citizens.
Thank you, Tim.
Good.
I wonder if there are additional questions on vaccines, as we have opened the floor to this exchange.